You were told your IUD strings are gone or missing. What do you do now? Is it something you may need to go to surgery for? Well, you should have options. You should get a choice. This is a stressful time. I deal with this issue every single day in my clinic where someone's referred to me because their IUD strings can't be seen in office. My name's Eric Schmidt, board certified OB-GYN, minimally invasive gynecologic surgeon. Again, this can be a stressful time. You have your IUD, you think you're being protected well for whether it's pregnancy or bleeding concerns, and you're in for your checkup, maybe a pap smear, and your provider is doing the exam and they don't see the strings. Well, should you panic? No, this is actually quite a common thing that can happen, and usually it has no issues at all. However, you do want to make sure and go through a couple steps to make sure you're still being safe, your IUD's in good position, it's not out or somewhere else. So quick recap. When someone's choosing an IUD for their contraception, it's a good, awesome, reliable form of contraception. And that IUD is inserted, and it's a little T-shaped device in the uterus, and there's little strings, flimsy strings on the end of it, which just hang outside of the cervix. And that's how we get it out. So this is an IUD. Specifically, this is a demo for the Kyleena IUD. And these are the strings at the end of the IUD that are right here. And it is a very flimsy IUD, soft edges, which is nice about this one versus the current copper one that's there. And so these strings here are the strings that attach to the lower part of the IUD. They're very flimsy. I mean, I can barely feel them when they're brushing up on my hands. But yeah, and so this is the insertion device for this IUD. So it's pretty skinny. So let's get this IUD back in its place. Again, this is a demo. So again, let's go through an IUD insertion. This is just a little demo kit again. This is the uterus. This is the vaginal canal, ovaries, tubes on each side. So IUDs are inserted. First going through the cervix. Often this can be the most uncomfortable part with an IUD, but it's cannulated through the cervix, and you push up, and you always have a light touch on the instrument. So I'm just going to show here, kind of on the instrument here, because I really want to feel that top of the uterus to know that I'm in the right position. Once I feel that light touch, I pull back, and you deploy the arms out there, if you can see. Slightly push forward, deploy the rest of the device. Okay, and so as you can see, the strings are hanging outside the cervix. In the normal patient, I would generally trim those, maybe to about there. And then often what they do, with time, these strings will start to curl. It's hard to do this here, but they'll start to curl around in the back of the cervix and kind of hang out kind of like that, and not causing a problem. However, they can sometimes curl up, and I'm going to try and do this, bear with me. There can be a number of different reasons why that IUD string isn't visible. The first thing you want to do when your provider mentions your IUD strings are missing is do an ultrasound. You want to confirm that the IUD is still within the uterus, and vast majority of the time it is. I think people often think the worst, the 1 in 1,000 perforation that happens, or that it fell out, and they're at risk for potential pregnancy if they don't want it. And so, but more often than not, yes, IUD is sitting right where it should. It's just the strings can't be visualized. So scenario number 1, the strings have curled up inside the cervix. Again, if the cervix is kind of like a donut shaped, the strings should be coming out and often curve this way or that way. They usually curve around the cervix when they're sitting in a good position. However, now they actually curl up inside the cervix and are just sitting within the cervix canal. Okay, here's our example again of the IUD placed within inside the uterus. The strings, as we showed before, should be hanging out here. However, we look, the strings are not. If we can see it, they're actually curled up inside. And so this is often that scenario 1 that we talked about. The strings are curled up inside the cervix and can't be visualized, and removed with often the what we call ring forceps, where you can easily grab it when it's in the canal. We need something a little different. Let me show you that here in a second. Now, office Pain control with these procedures should be addressed, and you should get adequate pain control with your procedures. See our other videos where we talk about the options for this, but you certainly are entitled to pain control for this procedure because we do have to use often a little skinny forceps to just slowly, kind of blindly grab progressively to see if that IUD string is sitting right there, and quite often it is. And so if you are somebody that doesn't like seeing medical instruments, I would maybe just skip forward a couple minutes. But this is truly the instrument that works really well. And again, this is the IUD inserter here, and this is the instrument. So thickness would be very similar. Okay, so this little skinny, I can do a little open like that and easily grab the strings. Again, proper anesthesia in the office. But with the now IUD strings that are up inside, grabbing them right here is not an option. Whether we do this in the office or in the hospital under anesthesia, similar procedure. We're going up with these little graspers. I'm going to push it in a little further to begin with, actually. So it's usually more like that, the strings, if you can see it. But we're kind of grasping slowly. And again, we can inject numbing medicine by doing a paracervical block with local anesthesia into the cervix at these positions. But we're kind of slowly and making sure you're comfortable, sometimes visually with ultrasound, but technique is you go in, open your jaws a little bit, kind of go around, see, and eventually, that's a little too soon, and so you're kind of grabbing and eventually you get the string and the IUD comes out just like it would in a normal situation. And again, reiterating that just because the IUD strings can't be visualized, if you get your ultrasound done and it shows that the IUD is still there, you could leave that IUD in place. You don't have to remove it just because the strings are gone. You would just likely come back to your provider who you referred to when you need that IUD out, when it's expired or you want it out for a different reason. There is also scenarios where the IUD shifts for one reason or another. Now, this can be an issue with insertion. The IUD doesn't get it. The provider putting it in thinks they're at the uterine fundus because they feel the resistance there and it's deployed, but maybe the uterus is curved, didn't get all the way to the top. Well, because the IUD is shaped the way it is, it often will try and find that ideal position getting up into the upper part of the uterus. However, now, because the provider cut the strings 2 centimeters long, if it shifts up 2 centimeters, the IUD strings will be higher and likely not visible. And so we see this a lot too. Okay, let's talk about that situation again where the IUD is maybe just improperly placed initially. And so you go up, you think you might, okay, I might feel the top, but I'm not quite at the top. And so I deploy it a little bit early and there. And so I cut the strings at the normal position, but then the IUD goes up a little higher with some adjustments, and now the strings are a little bit higher. I don't know if you can, maybe I moved it a little too much there, I apologize, but the IUDs can be shorter in that scenario, and someone might not see their strings a couple months later. Again, that's why you get the ultrasound, make sure it's in a good position. Or an IUD, potentially, this is rare, but can shift sideways. Again, bringing the tail of the IUD up higher, bringing the string up higher. And so why this happens, we're not sure. But the IUD could potentially do a turn sideways, bring the strings up. If an IUD isn't sitting correctly, we do generally recommend removal because it's hard to know if that's actually protecting you like it should. Sometimes for cases like this, if the strings are up higher, not directly in the cervix, I'll often use an ultrasound right at the bedside. Again, with proper anesthesia and the same little forceps, again, I would say super high chance of getting that IUD out without any issue and generally tolerated well with good anesthesia. Another scenario is that the IUD came out after the insertion. I find this particularly for people, one, who had their IUD placed directly after pregnancy, has a higher expulsion rate, meaning the IUD is pushed out completely. Now, you would think most people should notice this. However, if a mom is having irregular bleeding and clotting afterwards, and she might not completely notice if the IUD potentially falls out. More commonly, I see this for people with heavy bleeding, and we're trying the IUD for a good treatment for their heavy bleeding. The IUD could come out within a blood clot. This is, again, rare, and expulsion rates are still, less than 5 to 10%. But this can happen where an IUD, a blood clot forms and just takes it out. And so this does happen. This is why we get the ultrasound again, to make sure that it's still there. But this could be a scenario. Or if somebody has an abnormally shaped uterus. We don't always know this because we don't have an ultrasound right away before an IUD insertion, but someone might have a heart-shaped uterus or a septated uterus. And the IUDs aren't shaped for that, and so it might be pushed out due to this. The last one we'll talk about is uterine perforation. This is a super rare risk. This is the one people are most scared of. Rightfully so, but everyone thinks this uterine perforation is going to happen to them, but no, it's about 1 in 1,000 and potentially even less than that. And so uterine perforation is when the IUD goes through the uterine muscle because it's pushed through. This doesn't happen spontaneously. It's an issue with insertion. The IUD could potentially be pushed through the muscle. This is why if I have any issues with any of my IUD insertions at all, I will get an ultrasound right away. But in this situation like this, if the IUD is potentially perforated, it will require laparoscopic surgery to get out. So the best thing that someone can do for themselves when they have an IUD is kind of know their IUD and their IUD strengths. They can actually do the exam themselves to feel the length of their strings. Know that if those strings potentially feel a lot shorter one day, or they don't feel them, the strings all of a sudden feel a lot longer, that's something you want to talk to your doctor about right away, is because maybe that IUD has fallen out of position. But generally, again, for the most part, scenario number 1, the IUD strings are likely curled within the upper cervix. So please try not to panic if you can't feel your strings, but instead just call your doctor, wear backup contraception if you need it, or avoid until you talk to them, because maybe the IUD isn't working appropriately if it's out of position. But often we can identify where it is, good position, with an ultrasound, and whether or not it needs to be removed. We talked about that. But I hope this clears up some of those questions when it comes to IUD strings not being seen or visualized or felt. If you have any questions, other topic ideas for videos, comment below. And it's almost September. We're going to be doing 30 videos in 30 days in September and help support and fundraise for gynecologic cancers. And I picked out a society that helps in research and for gynecologic cancers. September is Gynecologic Cancer Month, so stay tuned for those. We'll see you all soon.